Here's our next patient, age 27. He came to us with back pain. Back pain worse on sitting and standing, better from lying down. He also had a lot of numbness in his hands. He had a feeling of a friction in the eyes. Friction in the eyes, a feeling as if eyes is pulled inward. He was spending lots of hours on the laptop with lot of eye strain and that feeling of a friction and pulling inward. He had a lack of balance. He felt his head was falling forward when he was sitting. Taito. Head felt as if falling forward when sitting. Premature graying of hair. Also he had a feeling as if he would fall on walking as well. So sitting and walking you felt as if you will fall, right? Occipital headache from eye strain. He gets anxious quite easily. He gets sweating from that. Sweets he loves, plus, plus, plus. Sleep can be sometimes very disturbed. Father had a history of oral cancer, mouth cancer. We started in January 22 with him with Argentum nitricum. Why Argentum nitricum? And sweets and anxiety, eye. It's a wonderful remedy for eye strain. You see, I'm going to share with you a few interesting differences here. And it's important to understand as well. At one of the factors here, he said that eye strain is resulting in an occipital headache. You got that? Your top remedy for this, when the patient tells you an occipital headache, is picric acid. Eye strain resulting in an occipital headache, picric acid works best. Right? Cold makes it better. Sometimes this, look here please, this pressure makes it better. Apply some pressure, it makes it better, or cold water makes it better. That's very typical. Now eye strain resulting, what he said, is a friction like feeling and as if a pulling inward sensation. Why not Ruta here? Why not Ruta here? Whenever you're thinking of Ruta, as a consequence of eye strain, the eyes either A, there will be a burning sensation in the eyes. There's a line in Allen's, burning as if hot balls of fire. Or they will tell you it's sore and I feel the muscles are strained.
Not radiating.
Not radiating. But they tell you its muscles feel strained. You know, if you consider the eye and this musculature, the extraocular muscles, Ruta has an affinity for muscles and ligaments. So the extraocular muscles feel strained and sore. You understand what I mean? So that strained feeling and sore feeling is more characteristic of Ruta. So if it was Ruta, I will tell you it's more strained and more sore feeling. You understand what I mean? Or it could be a burning sensation, as I mentioned. So whenever you are confused between a Ruta and arginate for eye strain and its accompanying symptoms, ask does it feel sore? Is it feel the muscles feel strained as if it has been overworked, or there is a burning sensation? That will definitely be Ruta. You understand what I mean? But with his case, you have to understand another factor here. One of the important factors is lack of coordination. You'll never find that with Ruta. Ruta is primarily muscles and ligaments. Whenever you see nerves are affected, it changes course. Ruta is no more indicated. Lack of balance when I'm sitting, when I'm standing. That's what I think what you mentioned. So that lack of balance, that want of coordination is very important for your arginate. Right? So eye strain resulting in eye symptoms. So what are the points for arginate again? Eye strain resulting in eye symptoms, even a headache. Arginate can have headache from mental exertion. In a patient who has desire for sweets, in a patient where more importantly is this lack of coordination, that lack of balance, I'm going to fall down. In a patient who is anxious, right, arginate will work best. And the neurasthenia, the nerve aspect, I'm having numbness in my hands. You see, one of the factors of arginate is you have to acknowledge the sphere of action. It's a neurological remedy. So whenever you come across cases where there is neurasthenia, he's telling of numbness in the hands, he's telling of lack of balance, you have to understand again, go back to your polycrest, that each remedy has a sphere of action. Ruta's sphere of action is bones, muscles, ligaments. It doesn't have any affinity for nerves, so it can't help you there. So even if you do not have symptoms corroboration, corroborate at least with the sphere of action. And there, arginate will help you.
In the same case, aversion to sweet is there. What could be the?
You're talking like a scientist now, giving you permutation and combination. What will come in? This is difficult to say, to be honest. So occipital headache with eye involvement, with lack of coordination in an anxious patient with neurasthenia. So that's very important for arginate. We started with 200, went up to 1M, 10M, 50M with arginate. I shared with you, he came to us in January 2022. Arginate completely removed the eye symptoms. Eye symptoms are better? Not there at all. It's 100% gone, right?
Yes.
So eye symptoms are completely better. That lack of balance?
Okay.
Okay, it's not there now.
No.
So it's not there now. But what was still remaining was the backache. Back pain. Backache was there, numbness of the hands were there, right? So we went to arginate 50M and we changed after that to Kobaltum. I've shared this remedy with you earlier as well. It's a fantastic remedy, Kobaltum. And this is a typical case, adapted to, if you read Kobaltum introduction, adapted to neurasthenic spinal states. So the nerve, what is the neurasthenia here? The numbness of the hands. And the modality of the back pain, please get it ingrained. Back pain worse from sitting, 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 sitting. Better by walking, better by lying down. What he mentioned, I think, lying down back pain is better. I went straight to a 1M. As it's a neurological remedy, as there is, it's a metal, Kobaltum works best in 200 and 1M. So after arginate, change the plan of treatment, Kobaltum 1M. হাতের অবশ ভাবটা কমেছে কত percent?
95%.
Hands are almost 95% better. Back pain?
95% better.
Huh?
95% better.
90% better with the back pain. Also another point for arginate, I forgot to share that, premature graying. You know, arginate is old looking, right? So that will, I think I mentioned that, premature graying, didn't I?
That's been arrested.
Yes, yes.
চুল পাকাটা?
What কমে গেছে মানে বাড়িনি কমেনি.
No new growths.
Right.
Right, no new growths, but whatever white is there, it's there. Whatever grey hair is there. Kobaltum 1M was prescribed only once, August 2023. We have boosted after that. November boost, December boost is coming to us in December. এখন কোনো সমস্যা as such?
না কোনো সমস্যা.
He's better, you know, it's almost 90-95% gone. I'll see him perhaps 1 or 2 times and then sign him off. You got the points for Kobaltum, back pain, worse from sitting, and you know, কি কাজ করো?
ইলেকট্রিক্যাল ইঞ্জিনিয়ার.
বসে কাজ না ঘোরাঘুরি?
ফিল্ডে বসে থাকে.
He has a sitting job and he goes in the field as well. But you know, especially for people who have a sitting desk job, Sitting for long hours, they will tell you I need a break.
Yeah.
Walking makes me better. Perhaps at the end of 2 weeks, you'll all need a Cobaltum, a single dose of it, right? We're boosting today.